Well, this brief lecture will be from Issues in Ethics in the Helping Professions by Corey, and Corey, 2019, 10th edition. This is the book that you will be reading for the entire semester that will help you to understand the ethics involved in the human services field. Chapter 1, Introduction to Professional Ethics, Making Ethical Decisions. This will be a very brief lecture regarding the steps that you need to take when having to make an ethical decision. You just finished doing a pre-test, and in this pre-test, there were 20 questions that you had to either agree or disagree with in reference to some type of ethical decision. So I'm going to use one of those scenarios to walk you through how to think about or the steps needed when making an ethical decision. One of the questions was as follows. A client who appears to dislike the group sessions says he needs to leave the session early because he has a headache. He wants to go home and take some aspirin. The Human Services Group leader has some Tylenol in her desk. She gives him 2 tablets in the hopes that he will remain for the session. Do you agree or disagree with the Human Services workers' action? The author's approach to thinking through ethical dilemmas, they give you 8 steps to think about when you are considering how to make a decision. The first one is identify the problem or the dilemma. The problem or the dilemma here is you have a client that doesn't like being in group and they want to leave. So they tell you they have a headache and they want to go home. So that's the problem. So, like, what do you do as a counselor? Do you listen to the client and let them go home? Or do you decide to give them maybe medication so that the client can stay? That's number 1. So that's the problem or the dilemma here. What do I do, right? Here, the question was asking, did you agree with the worker's decision to give medication, right? All right. So number 2, identify the problem or the potential issues involved. So here are the issues involved. Number 1, is the client even being truthful? We know the client doesn't like group. So are they really being truthful, right? Should you administer medication? Remember, we are not medical practitioners. We are counselors, right? Or should I just let the client go home? But if I let the client go home, does the client now know, hey, I can just say I have a headache and that's an easy way to get out of group. So here are all of the kind of thought, things that the counselor might think about in trying to make this decision. All right. Number 3, review the relevant ethical codes. So what do the code of ethics say? Well, let me just be clear. There's not going to be any specific codes of ethics that will address giving medication, but there is a code of ethics that says we have to make sure that we protect the clients from harm or danger, right? So in protecting the client from harm or danger, if I give this client medication, am I doing that? Okay? Am I actually doing that? So think about, once again, if there are any relevant codes of ethics, what do the code of ethics say? Number 4, what are the applicable laws and regulations? So once again, there may not be any laws in reference to giving this client medication, but please know that when it comes to the human services field, there are laws that are in place in reference to some of the things that we have to do. And you'll learn more about that in one of the future chapters. But what are the regulations, right? Think about where you work at. What are the regulations for where you work? Are you allowed to give clients medication, right? That is something that should be spelled out in the regulations for your agency. So find out what those things are. Number 5, obtain consultation. If you don't know, that's why you have supervisors there or other colleagues to get consultation. What should I do in this scenario? All right. Number 6, what are the possible and probable courses of action? So what can I do? I can give the client the medication so he can stay. I could let the client leave and go home, right? Or maybe there's a medical record that I can look at the client's records to see if it is possible to give the client medication, right? So here's some of the different, once again, actions that I can take, right? Number 7, enumerate and consider the possible consequences of your various decisions. So if I give the client medication, right? What if I give the client medication, he puts it in his pocket and never takes it? Maybe the client is suicidal. Maybe the client is trying to gather medications for that purpose, right? So that can be definitely a negative consequence that we don't want to see happen. What if the client is on some other medication that I'm not aware of? Could the Tylenol interact with that medication? Food for thought, right? What if the client is selling medication to somebody else? Food for thought. So what are the decisions? Like if I decide to give this client the medication, what will happen, right? Or if I tell the client, hey, just go home, come back tomorrow. Will the client then begin to think, all right, I can now use this as an excuse, right? And now the client is not getting what he needs because he's constantly trying to get out of group. So here are all the consequences that you think about whether or not you should give the client medication or should not. And then number 8, choose what appears to be the best course of action. So of course in this, I would not give that client medication. I am not a medical practitioner. Once again, we may not know what other medications the client is on. So it would be best just to let the client go home. And if you see that this is a reoccurring pattern, then you can address that with the client. Moral principles to guide our decision making. So here's some other things that we start to think about when we have to make decisions, or even when we're just working with clients in general, right? Autonomy. When we have to make certain decisions, we have to make sure that we are promoting self-determination and respecting the client's right to autonomy, right? So even in that client's case with the medication, if the client wants to go home, we have to respect his autonomy and his choice to be able to say, I want to go home. All right. So autonomy, non-maleficence. We want to avoid doing harm to our clients. So once again, I talked about the idea that, hey, if I give this client medication, could I be possibly harming the client because I'm unaware of the other medications that the client might be on, right? So we don't want to do that. Beneficence, to do good for others and promote the well-being of clients. So once again, how do we make sure that we are promoting the well-being of our clients, and what does that look like? So even for this scenario, how do I promote that client's well-being? If I'm seeing that this client is using excuses to get out of group, I have to find a way to make sure that I can engage the client in a way that will re-engage him in the group process so that I can promote that well-being. And then justice, making sure that whatever decisions that we make, that we are being fair to clients and that we're giving them all equal or equitable treatment. Fidelity, to make realistic commitments and to keep our promises. So when we're working with clients in general, we want to make sure that we are making sure that we are letting them know that we are making decisions that we can follow through on, that we're not promising clients things that we cannot do. All right, so that's fidelity. And veracity, to be truthful and deal honestly with clients. So what that means is that in our work with clients and making decisions, we have to be truthful with our clients, be truthful with the consequences of certain things that might happen. So we have to be truthful with our clients. Sometimes the truth doesn't feel good, but it is our responsibility to be truthful with our clients. So these are some things that you are about to read in chapter 1. And I just wanted to give you kind of a small verbal lecture about these things that we need to think about when we're making ethical decisions. All right. So once again, enjoy reading chapter 1. And as you read chapter 1, the book, of course, will fully explain all of these things that I'm talking about. But I just wanted to give you a brief introduction to understanding how to make ethical decisions. Thank you. Once again, this information is taken directly from our textbook, Corey, Issues in Ethics in the Helping Profession by Gerald Corey, Marion Corey, and Cindy Corey. Thank you.